How can physicians ramp up telehealth programs quickly? Find out on today's Medical Economics Pulse.
Many providers are like, well, I'm just going to do it right now for the span of the virus pandemic. And I think that's a little bit short-sighted, extremely short-sighted, to be more blunt about it, because patients and clinicians and your staff are all going to start learning telehealth, and then you're going to close that off, and you're going to have a very large section of patients that are extremely satisfied with patient telehealth.
Welcome to the age of telehealth. While telehealth has been gaining popularity for years, the COVID-19 pandemic means all physicians will start relying on remote care to treat their patients for the foreseeable future. But many practices are behind the telehealth curve and are scrambling to catch up. They need answers, and Medical Economics Pulse is here to help. Today, we are joined by Haden, the president of DRexly Health Solutions, who will help us provide a crash course for physicians looking to quickly set up a telehealth program. Haden, thanks very much for joining us today.
Thank you very much for having me, Chris. Appreciate it.
So just to get started, I wanted to talk about the scope of this crisis. There's a ton of physicians out there scrambling to try to put a telehealth program together. And I just wanted to maybe start with, is there anything you can say to ease their mind, sort of prep them, to motivate them to get going with a telehealth program?
One is they're not alone. It's not limited to just physicians that are scrambling. I've on a conversation with a medical school in New York that's trying to get on telehealth right now with 200 physicians, and trying to sort out what they can do and can't do. They've not been exposed to the rules and regulations. And so it's a crisis not only nationally, but internationally. I've had requests from providers of all sorts from other countries as well. So I guess the only solace I could say is you're not alone. And so it's not unique that you're in this situation if you're just brand new to telehealth.
I know one of the big changes right now that is both sort of a confusing part for physicians and an opportunity is that the government has really loosened restrictions on telehealth. Can you explain what some of the rules that have been in place with telehealth are, and some of the ways that the government is sort of loosening the reins on telehealth to sort of help physicians and patients connect during this pandemic?
No, that's a great question. So my background is not telehealth. Actually, I started this organization a year ago. My background is health plan network contracting. I was a health plan compliance officer for 5 years, and very much on the plan side was interested in telehealth. And in 2005, as the chief network and compliance officer for a regionally based health plan in California, was trying to figure out how to do telehealth. Even though the laws were passed, the technology was available back in 2005, I, as the payer, couldn't even put it all together. So launch forward to 2020, if you take the laws and regulations that were in place on December 31, 2019, and summarize all 50 states, it's 500 pages long. It's overwhelmingly complex. It's different by state, payer, Medicare, Medicaid, commercial. And so what's essentially happened is the last 8 months of my work of trying to drill down in each state, working with my clients and customers, is that they have been flushed down the toilet in a good way, right? Meaning a lot of expansion has taken place in the short term that is due to the emergency, that you can use Skype, you can use Zoom, Google Hangouts, you can use any kind of live video connection with patients, and they're not going to enforce those rules during the pandemic. The problem will be is those are going to snap back as soon as it's over. And these are executive order level guidance. So this will be the relaxation of the enforcement. So the rules are still there. They just relax the enforcement. That enforcement will come back hard and heavy at the end of the pandemic, meaning hard and heavy for those that aren't migrated on a telehealth at that point, and in a HIPAA compliant manner, if that makes sense.
Yeah, and that was a question that came to mind. It was HIPAA. So what's sort of the relationship now between telehealth under the loosened restrictions and patient privacy? it sounds like you can use a wider variety of platforms, but I'm wondering, you still have to sort of make sure it's secure in terms of HIPAA, correct? Can you kind of talk through that a little bit?
You want to still use, one of the common myths about telehealth is it's this big abyss of blackness for a clinician. And initially when they start, that's how, that's where I was faced with together with them. And when they start delivering healthcare that way, they find that the same protocols and both clinical and administrative are still in place. You still need to have a HIPAA compliance program. You still need to ensure PHI is maintained and on a need-to-know basis. This is not a free-for-all by any means. You want to get guidance from state non-biased resources such as your state medical boards. There are telehealth resource networks are chartered specifically to assist in telehealth adoption that are nonprofits across the United States that are funded by federal and state funds, are a good resource. So what my recommendation to my clients and providers is I give them the guidance that I've found federally and state-wise, and then always say, hey, here's a second source to validate that. So you want to get it validated by two sources. Even my own, I always provide my providers, anybody who asks me this question, is here's a source, here's a secondary source to back that up. Because it is a very challenging time from a compliance standpoint in keeping up with all the rules and regulations that have just taken place. You have the executive orders around HIPAA that have just hit within the last week and a half. The federal stimulus package is hopefully about to be passed today. It has got a lot of changes in telehealth rules and regulations that are going to be put in place that are not going away in a good way. And so this is just, if you have to recall, remember, once it's signed into law, that law is guidance for the regulators to implement regulations. So the law is giving guidance to CMS to implement regulations to have telehealth be expanded going forward for Medicare. And that federal law overarches state law. So a lot of that 500 pages of summary that I talked about, that's going to decrease substantially for both commercial Medicaid and Medicare.
Okay, great. Okay, so let's sort of give a crash course for physicians.
Okay.
Right now, you're in a situation where you have a practice where it's hard to see your patients in person. Maybe you're a physician that have always liked the idea of telehealth, but you're too busy. You've seen patients every day. There's all this kind of stuff that goes into running a practice, and you're just behind the eight ball now. So right now you're panicking. You're like, I need to start a telehealth program. I need to be able to connect, especially with maybe my patients with chronic conditions and patients that need more attentive care. What do you do? What's the first thing you should do to get started saying, okay, I need to ramp this up quickly. How do I go about doing it?
Don't panic. Take a deep breath. This is an emergency that's facing everybody, myself included. So when I get these calls all day long, we need it now, and think about what you need now versus what you want. And telehealth is what I tell providers when I'm speaking with them. So even if they're brand new to it, they call me with that question. And you could purchase a very expensive system today, but you don't need it very expensive today. You need something that just gets the job done. And so there are some very good solo entry-level platforms out there that providers can get on and start to use today that are HIPAA compliant, have all of the functionality that everybody looks for in telehealth. And then as you get more familiar and used to using it, both your practice and you as a physician, you'll then start to really, your eyes will wide open about the breadth and width that telehealth can provide. It's overwhelming, to be honest with you, the functionality of it that's out there. So don't get excited about that when you see it. What do you do? Right now you're doing medication refills. That's a 15-minute visit. Let's put all of our medication refills on telehealth. If you have a calendar option on your platform where patients can self-schedule, block out 2 days a week for them to self-schedule for medication refills, for example. Each one is a little bit different, but at the end of the day, each clinician is going to bill a handful of E&M codes, is their tray. Figure out of those which ones make sense to do telehealth-wise, and just focus on being successful in that area first, and then move forward.
Okay,
That
great.
makes sense? Yeah.
Yeah, definitely. I wanted to ask a little bit about equipment. So what actually do you need? I mean, is a tablet enough? Do you need a webcam? Can you talk a little bit about what
Sure.
basic equipment you need to do this?
Okay, so right now, today, you can use a tablet, you can use a phone to connect with your patient. However, that is not going to give you any kind of record of the visit, notes. There's no interchange of medical information. Many providers have websites already that do some secure intake form, for example. But let me just start with the list. It's not just what the clinician needs, it's what the patient needs. So the clinician needs a computer, they need headphones, and they need a microphone at the bare bones. Yes, there are platforms out there that will function on a tablet or a smartphone, but there aren't that many, but all of them function for the clinician on a computer. Now the patient is actually, they developed the platforms so that the patient can be on a smartphone, an iPad, and a computer. That is out there already. So the patient efficiency or access is very good. There are some platforms that allow you to do that, but from a telehealth standpoint, those are the bare minimums to start with, but you also have to ask, what does the patient need? So when you start talking about doing an exam of a patient, my first question I get is, well, how do I conduct a physical exam? Well, if you think about it, this is where the patient and their family can really be engaged. I brought a couple of points. I think everybody's got one of these nowadays, a thermometer. So when you're first opening up with the patient, ask them what their temperature is. Have the patient take their pulse. I unfortunately suffer from hypertension. The VA, I'm a vet, I take my own blood pressure and I chart that. And I tell the VA what my blood pressure readings are since the last visit. I have a scale to take my weight. If I have a family member that can participate, they can check my abdomen for tenderness. You'd be surprised how much a diagnosis can be done. If you take an iPhone and you have the camera switched around, the patient can open their mouth and you can check the back of their throat. You can have them angle the camera up into their nose to check for, a sinus or any kind of redness or irritation. The big piece that we're missing here is the stethoscope, right? That's right off the bat. Being a former paramedic, I know the importance of a stethoscope, making sure that the lungs are all clear in all four fields. There is telehealth stethoscopes out there that work fantastic, that are reasonably priced. But for most of your visit, medication refill is a great example, just to keep it simple. You're not even going through the vitals a lot of times. A lot of times it's just a refill of something that's already existing. And clinically, if you're comfortable with prescribing without doing vitals today on a face-to-face visit for a med refill, why do you need to, it should be the same, it should translate into telehealth. Sorry for the long answer, but all of these questions open Pandora's box.
Oh no, I mean, I think
yeah.
it's perfect, because I think the more detail we can give physicians now,
Yeah.
the better off they'll be. Can you talk a little bit about, obviously there's patients out there, every physician has, I don't want to stereotype, but older patients who maybe aren't comfortable with technology, would never choose telehealth for their doctor visit in a million years, but right now may need to do that. In what way can your practice sort of reach out to those patients? Obviously it's tough. You can't actually go and see them. We're trying to social distance and all that. So how do you sort of have your staff perhaps help these patients sort of become as comfortable as necessary with whatever equipment they have, a smartphone or whatever, to be able to do this effectively?
The way that you train your patients now is the way you're going to train them on telehealth. And what I mean by that is, if you're doing verbal discharge instructions and you're finding them effective, I think, with your patients, then you're going to pick up the phone and make a phone call. And if discharge instructions in writing are effective way of communicating to your patients from a clinical standpoint, then integrate that into your same way of how you educate the patients on telehealth. You want to kind of keep it as similar as possible. Every provider has their own way of being communicated to. Every patient has their own way of being communicated to.
Great. Yeah, so what it sounds like is it's okay when needed to use old technology like just a phone call and
Yeah,
an email and those kinds of things.
it
If
is
that's
right
the level that the
now.
patient needs to be met at, it's okay to. We don't need to do everything by video and all that necessarily.
Right. Well, Texas just passed law enabling for phone consults to be allowed, which is a big step.
Yeah.
The feds have as well. That again, that is closing down. I mean, from tracking the regulations and whatnot, phone calls over the medical consult phones are going to be limited. Now, the good news is that any reasonable telehealth platform will allow you to make a secure HIPAA compliant phone call to your patient. It just needs to be encrypted, it needs to be secure, and it needs to be HIPAA compliant. And so what do I mean by HIPAA compliant? Any telehealth vendor you use, the number one thing you need to ensure that you get from them is the business associate agreement, the BAA. Without it, you are not HIPAA compliant. And there are, Zoom, these other entities, they have some features that are HIPAA compliant. And yet, if they aren't willing to give you a BAA when you're purchasing them, you need to turn and find one that will. I can't emphasize that enough, because then you are at full risk for any privacy breach. If you have a BAA with the telehealth platform, then they are at risk of a privacy breach due to their platform.
Yeah, that actually raises another question. The BAA is a great point because, physicians, I think, need to know that they always need to have BAAs
Right.
with any third party that they're working with.
Right.
But sort of beyond that, if you're out there shopping and you're shopping quickly for a telehealth partner, what are some things you should look for that they provide? What are some red flags maybe to look out for? Can you just kind of give me sort of like your buyer's checklist as you're sort of like looking for a potential telehealth partner?
Free isn't free, right? It's kind of a rule I have. So there are free platforms out there. And when I talk to providers about, I'm pretty open about what's available out there. Mine is not free, but it's pretty at the really well-priced month-to-month kind of entrance thing. But I would be leery of free. But if that's what can get on the roof, get you going right now, then do it. Many providers are like, well, I'm just going to do it right now for the span of the virus pandemic. And I think that's a little bit short-sighted, extremely short-sighted, to be more blunt about it, because patients and clinicians and your staff are all going to start learning telehealth, and then you're going to close that off, and you're going to have a very large section of patients that are extremely satisfied with patient telehealth. J.D. Power did a consumer satisfaction survey of telehealth experience that they released in November 2019, and those that used it, they scored it very satisfied or very satisfied. 46% doesn't sound like a big number, but it was the highest, some of the highest in healthcare. It ranked for among banking and finance. And so what that tells me is that the patient satisfaction with telehealth is phenomenal. Most entities are very focused on patient satisfaction. Clinicians, if you're in any type of integrated or value-based care models, many of those PCMH and whatnot have a patient satisfaction component. This is actually a great way to increase your patient satisfaction through telehealth. Patients find it very appealing. It's very convenient for the patient. They can be seen at home in the privacy of their car. They get to select the setting that they're most comfortable with to receive their care.
So the one question I have is about how to sort of integrate your clinical team within a telehealth program. So how do you sort of, if you're a physician, you have other team members, nurse practitioners, physician assistants in your practice, how do you sort of go about managing that team via telehealth? Can all of them see patients via telehealth? How do you sort of manage what types of cases you see the different practitioners see?
So that's a great question. So telehealth, and by no means is restricted to just the physician. Counselors, nutritionists, nurses, your case managers, treatment for autism, telehealth, substance abuse for telehealth. There's a multitude of ways of angling telehealth. And right now we're just looking at the physician practice that's facing out to the patient. But if you just think about this point, is that if you envision the patient walking into your practice, they're going to see the receptionist. They're going to check in. They're going to take copay. They're going to schedule their follow-up. the receptionist can be on the telehealth platform functioning in their role as a receptionist and scheduling. Then readies the patient up who moves in for an evaluation intake form. Did the intake form get completed? And this should all be securely sent, by the way. Patient intake forms through any reasonable telehealth platform. A telehealth platform should engage both intake forms, your discharge instructions should be able to share back and forth with the patient, all medical history. You can have SOAP notes on there if you wish. It's not a requirement, but some kind of record of the visit. So when you're thinking about telehealth, a lot of things times I do is before I do a demo, if I'm talking with the physician owner or I'm talking with an office administrator, is that I want to have the demo with both of them and all of the staff possible. More the better, even the billing company, because they're going to ask questions. Well, how do I bill for telehealth? And it's actually pretty straightforward. For Medicare, you bill with the place of service 02. For other payers, it's typically a GT modifier, just to note that it's a telehealth visit. It's the same CPT code. Nothing has changed, but the billing company may not know that. So I try and plus they're interested in learning about telehealth as well. So we try and do demos with the whole team so they can see angles of both clinical delivery, but also administrative delivery of healthcare.
So we talked a little bit about make sure you're capturing the telehealth visit within the medical record. Can you talk a little bit about whether telehealth providers generally capture that stuff automatically, and just in general what physicians need to do to make sure that the record is being captured so they can bill for it and get paid for it?
So great question. And to give you, there's a lot of ways to capture that information. A platform like my own captures the time that the visit started, whether it was a video, whether it was an audio secure phone call. If the patient submits a medical history, blood pressure, medications, and whatnot, that's captured. If they submit an intake form, that's captured. If there's discharge instructions sent to the patient, that's captured, as well as the payment and the type of visit, if the physician so chooses it. And then that's simply downloaded into the EMR for each patient, and then encapsulated into the visit. Now, think about this for a second. We're talking about the EMR. So the provider can be doing the telehealth visit here, typing into the EMR like they already normally are doing. They don't necessarily need to grab the notes from the record itself. I have providers that don't have EMRs and that scheduling system is still a day planner and are on telehealth and doing just fine. So it can be done. It just takes a little bit of intuition and thought about how does your, again, I can't emphasize it, clinical and administrative flow goes, and you fit it into your system as best as you can. Now, you can spend a lot of money and have it all interoperable, where the scheduling and the billing, all that works for the EHR. But right now with this epidemic, I don't recommend that to any provider to spend that kind of money unless they're already committed to really going telehealth and already have a game plan for it.
Eric Haden, thank you very much for joining us today.
Thank you very much, Chris. Appreciate it.